Hi guys, my name's Nikki Kramer, and today we'll be talking about tetanus. Most of you probably know tetanus as what's called lockjaw. While tetanus does cause lockjaw, that's really only the beginning story of what is this disease. For those of you who are unfamiliar with tetanus totally, I'll give you a little bit of an intro. Tetanus is the constant contraction of muscle fibers within the human body. These muscle fibers are so tense that they can cause bone fractures, muscle tears, cardiac complications, and respiratory failure, which is what most people die when they are infected with tetanus. Mortality for tetanus can be up to 60%. Since 1902 or since 1920, since the invention of the vaccine, the case incidence has gone far, far, far down. In developing countries such as the US, in places with the vaccine available, in places and with undeveloped countries that don't always have access to this vaccine, tetanus is still a real problem. So what is tetanus and what causes it? Tetanus is caused by the bacteria Clostridium tetani, which is an obligate anaerobe, meaning it can't survive in an environment with oxygen. And so I say it's commonly found in soil. I mean deep, deep, deep down, not the top layer of soil. However, tetanus spores can be found on the top layer of soil. These spores is what makes this bacteria so dangerous. Because not only are spores just in general very hard to kill and very resilient, these spores are what release the tetanus toxin called tetanospasmin. Tetanospasmin is the agent which attacks your nervous system, which ultimately causes the constant contractions within your muscles. How do you get it? Tetanus cannot be transmitted human to human. You cannot get it from a friend who has tetanus. That is not how it works. You can get it through direct contact with contaminated objects. However, even though you might touch a contaminated object, the spores have to get into your body. So, route of entry is through a broken barrier. This could be a lot of things. A lot of people use the example of a rusty nail. Yes, that is true. But you can also get tetanus from a clean, open wound. The key is not so much clean or dirty, it's open. So there's a lot of ways you can get it. Tooth extraction, burns, middle ear infection. There are a lot of babies in underdeveloped countries who get it from a placenta, from the umbilical cord. Not placenta, I apologize. From the umbilical cord. When the doctors cut the umbilical cord with an unsterilized object or in an unhygienic environment, if those spores are present, they can get into that baby's bloodstream and ultimately cause tetanus. And then where is it commonly found? Tetanus is usually found in soil, dust, and manure. So when it does get into your body, what does it do? Pathology. Once tetanus enters your bloodstream, these spores will release the toxin tetanospasmin. And as more and more bacteria is produced, more toxin will be produced. And as that toxin builds up, it can make its way into your nervous system. It will, from your bloodstream, go into your motor neurons. These motor neurons are the nerves which control your muscle fibers. It will travel up these motor neurons into your spinal cord, which takes around 2 to 14 days depending on cases. Once it's in your spinal cord, it will jump from your motor neuron into your interneurons. These interneurons are known as Rensaw cells. These Rensaw cells are inhibitory neurons themselves, but this toxin inhibits their inhibitory job. The Rensaw cells are in charge of telling the motor neurons, hey, stop firing, take a break, calm down. Without the Rensaw cells to give this signal of relax to the motor neurons, these motor neurons will just keep firing and firing like they're running a marathon. So the real victim of tetanus is these Rensaw cells who lose function because of this toxin, preventing them from releasing their neuron transmitters or signal to the motor cells to prevent them from constantly contracting. Now, let me introduce you to a man named Sir Charles Bell. I will tell you, I would hate to be this man's academic advisor because he could probably not pick a major. This man did practically everything. He's really cool. He was born in 1772 in Edinburgh, and he became a surgeon for the most part. I mean, he does a lot of things, but he was mostly a surgeon and an academic and a medical illustrator. He volunteered to go help soldiers in the Battle of Waterloo, and while he was there, and also while he was in his normal practice, he drew lots of really cool illustrations of some of the diseases he saw. He was very interested in the nervous system, and particularly in the cranial nerves. I don't know if any of you have heard of Bell's palsy, but that is what he is known for, and it's named after him. But out of all of the illustrations he made, his most famous artwork, and most known, is called Tetanus Following Gunshot Wounds, and he made it in 1809. As you can see in the picture, this patient is suffering from severe muscle contractions, and he is in the position which is actually a named symptom of tetanus, and it's called opus thotosis. I tried my best. And what happens in this is that your muscles are so severely contracted that it causes an arching of your back, neck, and spine, and it causes you to rest on the top of your head and the back of your heels. And this is actually like the last symptom you experience before respiratory failure. So let's talk specifically about the symptoms. So tetanus only affects your motor neurons. Your sensory neurons are completely intact, which also means you can feel all of the pain. So, yeah, not all the neurons are affected, but not good. When you are infected with tetanus, you will have an overactive sympathetic nervous system. Your sympathetic nervous system is actually what is in charge of your fight and flight response. So, these symptoms include drooling, difficulty sweating, fever, problems breathing, and irregular urination and defecation. There are actually 3 poster signs of tetanus that doctors look for after you have become infected. Trismus, which is what people commonly see tetanus as, lockjaw. It is the contraction of your muscles right here. If I was to use a model, it would be, I don't know if you can see, but these muscles right here that control the opening and closing of your mandible and your maxilla. And so those muscles are so contracted like this, you can't open your mouth. After that, you'll experience what's called the Sardinian smile grin, which is in the second picture. And that is when these muscles up here also contract. So it looks like you're constantly smiling and you can't relax, which is actually very, very painful. It's not just smiling. It's like when people say like cheese and you're trying to smile for a picture and it takes like forever to take the picture. After that, we get to the opus thotosis. I'm still trying to say that word right. Position that people get into when they have severe contraction of all their body muscles. And as I said earlier, it is very common in babies, especially in underdeveloped countries. So I included that heartbreaking photo. Sad. Also to include the symptoms, there are technically 3 types of tetanus. One is the most common tetanus, which is generalized tetanus, which includes these 3 postmark signs, and usually ends in respiratory failure, and even seizures can occur. A more rare form is called local tetanus, and that is limited to the area of injury in which the spores enter. It's usually actually does not cause mortality. It's usually very, after a few months, it will just go away. The rarest form of tetanus is called syphilic tetanus. And this is just when it's limited to the 12 cranial nerves in the head, and it's usually caused by skull fracture, middle ear infection, tooth extraction, and this, out of all three of them, is the most fatal. So when you do get infected with tetanus, what do? If you get infected with tetanus, you need to be hospitalized immediately. Go see a hospital immediately. Do not wait. There's no like home care for tetanus. Please. If you don't have the vaccine, go to the hospital because you will need intensive care and wound management. You will also need to get the tetanus immunoglobulin shot, which needs to be administered 48 hours before the toxin has traveled all the way throughout your body. And they usually give this to you if you come in with some sort of wound, if they don't know your vaccine history, or if you are insufficiently vaccinated, which we'll get to when we're covering the vaccine. This is used because it contains antibodies that they can just inject into your blood to help fight that toxin. And although there is no cure if you already start presenting the signs of tetanus, so if you don't get the tetanus immunoglobulin and you have already experienced the lockjaw, what they'll do is they'll give you muscle relaxers and pain medication. It takes months for these nerve endings and muscle fibers to regenerate, so you can be in intensive care for a really long time. But I mean, if you don't, you probably die. So I feel like you should go to the hospital. Or better yet, get vaccinated. So the first sort of vaccine that was created was the tetanus antiserum in 1918. However, it provides even less immunity than the toxin which we have now. It only would provide immunity for a few weeks. In 1924, the tetanus toxin was created. It is an inactive form of tetanus which triggers an immune response. And today there are 4 different types of shots they can give you. The main difference between them are when you receive them and the combination of different diseases it protects you against. It's usually diphtheria, tetanus, and whooping cough. That's what the D, T, and P stand for. Whooping cough is pertussis, by the way. And because this toxin does not give super long-lasting immunity, it is why you need to receive multiple doses. There's a primary series of 3 doses that should be given at infancy, and then a dose of containing this toxoid vaccine when you're around 4 to 7, and then another booster when you're just about a teenager, and then after that, you'll probably be getting one every 10 years. Which, yes, it may be a hassle to some people, or as Dr. Cody says, it might hurt. But it sounds like a pretty good trade-off, right? Okay. And then that's why we're excited. I hope you guys liked the video. If I was to conclude with something, I would say just go get the vaccine.